Welcome to Bradykinin Beats, a dialogue with global experts about Bradykinin-Mediated Angioedema. My name is Kenny Robinson for Pharvaris. Our third episode in this series is called Decoding the Importance of Bradykinin-Mediated Angioedema, Patient-Reported Outcomes in Clinical Practice. The purpose of the podcast is to explore the role of patient-reported outcomes, or PROs, in evaluating disease burden, treatment response, health-related quality of life for people with Bradykinin-Mediated Angioedema. We will discuss PRO assessment tools used in Bradykinin-Mediated on-demand and prophylactic care, and illustrate how they can provide clinical insights into patient experience, enabling healthcare providers to make informed, patient-centered decisions to optimize disease management. Today, I'd like to introduce you to Dr. Mark Skrupa. Mark, could you please share a little bit about yourself?
Absolutely. So I'm boarded in allergy and clinical immunology. I spend most of my time at the Institute for Asthma and Allergy, which is a ACARE reference center for hereditary angioedema. My area of interest is chronic hive and swelling disorders, or urticaria and angioedema. I'm also faculty at the Johns Hopkins Asthma and Allergy Center in Baltimore, and our clinic has around 110 patients with bradykinin-mediated hereditary angioedema.
So today we're going to focus on the role of PROs in bradykinin-mediated angioedema clinical care in both on-demand and long-term prophylactic settings. Can you explain to the audience what PROs are and what they're used for?
Certainly. So PROs are patient-reported outcomes, and these are validated, standardized questionnaires. They can be as short as a single question, or they can be multiple questions. They're administered to a patient without the input or interpretation of a healthcare provider. And what it allows is for patients to give their perspective on their disease symptoms, disease control, the impact of the disease on the patient's quality of life.
Why are PROs important for bradykinin-mediated angioedema clinical assessment and disease management?
So bradykinin-mediated angioedema is notoriously unpredictable. We can have patient visits where at that moment in time, a patient is very well controlled and doing well. But that doesn't mean that the patient wasn't having issues 2 weeks ago or 4 weeks ago. And so when we use these PROs, it often allows patients to give an assessment of their disease control, severity, quality of life over time, so that we're not necessarily just assessing a patient at one point in time, but getting a more global or generalized picture of the patient's disease control, disease burden.
So let's discuss these assessments in the context of bradykinin-mediated angioedema attacks, which can be presented very differently in the same patient over time. What key factors do you ask your patients to notice, track, or describe when they experience an attack or when they treat it?
So for acute attacks, there's a number of data points that I ask my patients to note. Number one is the frequency of attacks. How often are they getting hereditary angioedema attacks or bradykinin-mediated angioedema attacks? Second is the location of the attack. Third is the severity of the attack. Fourth is, do they intervene, and when they intervene, when did they choose to intervene? And then, of course, how impactful are the attacks on their quality of life?
So as you know, there's many tools to assess PROs. Let's focus our conversation today on a few of them. Let's start with the Patient Global Impression of Change, PGIC, and the Patient Global Impression of Severity, PGIS, which have been used in assessments in the context of acute attacks in response to on-demand treatment. Can you explain to the audience what PGIC and PGIS are?
Yes, so they're both single question assessments. PGIC is an assessment of change in disease symptoms over time. PGIS is a change in disease severity over time. If we start with PGIC, we're looking for an improvement or lack of improvement over time. So if symptoms are getting very much better, that might be a score of 7 on a 0 to 7 score. Or very much worse would be a score of 0 to a 0-7 score. And we can then apply that over time to understand that if we intervene in treating an acute attack, at 1 hour, have things gotten better? Have things gotten worse? Similarly, at hour 3, at hour 5, at hour 6. This is quite similar to PGIS. So PGIS is looking at severity over time.
How do you integrate the information gathered from these tools like PGIC or PGIS with other clinical assessment to guide your decision about on-demand treatment for bradykinin-mediated angioedema?
So the nice things about these tools is, again, they're validated and standardized. They always, help us remember to ask patients about some of these specifics and in understanding how an acute attack is treated and how successfully it's treated. But we also ask, more open-ended questions like, how do you feel that you're doing? How do you feel that your therapy is working for you? How do you feel that your current therapy compares to past therapies you've used? So this is just one of multiple data points in, again, assessing how well, when we're talking specifically about acute bradykinin-mediated angioedema attacks, just how well the patient's therapy is working for them.
In 2023, the Aurora Consensus established 5 key outcomes recommended to be measured in clinical trials for the on-demand treatment of HAE attacks, including change in overall symptom severity, time to end of progression, need for additional treatments during the attack, impairment of daily activities, and treatment satisfaction. While these are designed for HAE clinical trials, these recommendations can be applied to all forms of bradykinin-mediated angioedema. So what's the importance of assessing these key outcomes during routine care?
So although these outcomes are important in clinical trials, they're also very important in routine clinical care. These are many of the things we care about in assessing how well a patient is doing on a day-to-day basis with their disease and how well they're managing their acute attacks. As an example, we know that some acute attacks require a secondary treatment, a secondary therapy, and that is a measure of whether or not the first treatment was durable and sustained. And in a clinical trial, often that means that patients are getting a second dose of a different drug. But in the clinic, most patients only have one acute therapy, and if frequently they're requiring a second dose, that's a measure of relatively poor durability of the first dose. And when we hear that patients require second doses frequently, then often that begins a discussion regarding whether or not their current acute therapy is the right acute therapy for them.
How important is it for early treatment response to be sustained and with no reoccurrence of manifestation throughout that course of attack until that complete resolution?
I think it's extremely important. I mean, in this day and age, we have more patients on prophylaxis. We thankfully see that more and more patients are controlled. But even patients who are controlled on prophylaxis still do get some acute attacks. And when they get acute attacks, they want to have some degree of predictability, that they know they can treat their attack, treat it quickly, have a rapid response, have complete resolution, and can then go about their lives.
While the PGIC and PGIS tools are used in bradykinin-mediated angioedema to assess treatment response to on-demand treatment, a few years ago, the Angioedema Control Test, or the AECT, was developed to assess treatment response to long-term prophylactics in bradykinin-mediated angioedema. Can you tell us a little bit about this tool?
Yeah, so the AECT is a tool we use very regularly. It assesses patients' angioedema control on a 0 to 16 scale, and it allows us to understand their control over time. And so if a patient has had very good disease control in the month coming into their appointment, we say that they have high ACT scores. If they have very poor angioedema control in the month coming into their appointment, they have low ACT scores. This is derived from another control test we use called a UCT, or urticaria control test, that actually predated the AECT, but has very real similarities.
So in addition to assessing the treatment response and disease control, and PROs can also be helpful to measure health-related quality of life. The Angioedema Quality of Life Questionnaire, or AEQOL, was created for that purpose. Can you tell the audience a little bit about that tool?
So here again, in almost all diseases, there's been a real emphasis in using QOL measures. And I think we use, in angioedema, very objective measures like how often are you having an attack, or how often are you requiring rescue medicines. But that doesn't always capture how impactful the disease is on the individual patient. And here, QOL PROs can be very helpful in assessing just how impactful the disease is on any individual patient. After all, there may be a patient that has a relatively high attack rate, but feels very confident treating their attacks, and is actually quite comfortable with the disease, and it's not impacting their quality of life much on a day-to-day basis. Conversely, another patient, because of the unpredictability of their disease, may have a low attack rate, but it's having a huge impact on their quality of life, and that would be a sign that, again, adjustments may need to be made in their care so we can improve their attack rate and thus their quality of life.
How do you integrate the information gathered from these tools like the ACT or the AEQOL or other clinical assessment to guide your decision about prophylactic treatment?
So there's not any one of these tools that we use solely. We use these tools as multiple data points, as well as many subjective data points and illustrative data points from any individual patient. I think, again, though, because they're standardized and validated, we really do understand that if an AECT is low, it really is a measure of poor disease control. And thus, in a patient who isn't on prophylaxis but has a low AECT, there might be a recommendation to consider prophylaxis. Conversely, if a patient is already on prophylaxis and has a low AECT or a low QOL, then having a discussion about what their other prophylactic therapeutic options are is a necessity.
So in your clinical practice and clinical experience, have you encountered challenges or barriers when incorporating the PROs such as PGIC and PGIS in the context of on-demand treatment? And the same thing would apply to the AECT and the AEQOL in the context of long-term prophylaxis in routine clinical care. And if so, how have you overcome them?
So starting with AECT and angioedema quality of life, I find them easy to administer. We often have these kinds of PROs administered to patients even before we've seen them, so administered by staff. They're not terribly time-consuming for patients, so I really haven't found that it's terribly burdensome to use AECT or quality of life. I think the greatest challenge with PGIS and PGIC is simply that they're best used acutely during an acute attack. And many of our patients aren't actually physically having an acute attack in our office. They had one 2 months ago at home or 3 months ago in an emergency room. And so we do at times have patients come in with an acute attack. When that's the case, then it is easier to use PGIC or PGIS, but using them retrospectively just are challenging. So it doesn't mean, though, that the data that we would get from PGIS or PGIC isn't important. We still try to ask questions and have some description of an attack that occurred even months ago to understand how rapidly the disease or the attack was controlled, how long they were symptomatic, etc.
When you're having discussions with your patients about these patient-reported tools, do you use them to show improvement or in that dialogue, in that conversation with your patients in terms of the value of them?
So most typically I use them to show change over time.
Okay.
And change over time can be improvement that, when we first saw you, this is what your attack rate looked like, this is what your AECT looked like, and now that you've been on drug X for the past year and a half, this is what your AECT looks like today. Conversely, we may show that there's a loss of control over time, and that, again, is an important conversation piece to discuss, again, maybe making changes in a patient's current therapy.
With so many therapies out there in terms of the long-term prophylactic, how have you used these tools in your conversations with payers?
So, again, I think it's very important, particularly when a therapy is being reauthorized and particularly when that therapy is successful, to be able to show a patient that prior to going on therapy, the patient had poor disease control as measured by a standardized PRO, again, like something like AECT. And now, after a year on therapy, they have very good disease control as measured by AECT. So this is one of the data points that we certainly submit annually when we are trying to get a therapy in HAE or bradykinin-mediated angioedema authorized.
So to wrap up our conversation today, what final advice would you share with the audience about using PROs in clinical practice, especially in bradykinin-mediated angioedema care?
So I think it's becoming very, very typical in medicine, and I think it's not only specific to bradykinin-mediated angioedema, But for many of the diseases I take care of in allergy and immunology, we have PROs. And I think that we're all busy. We could all forget to ask our patients sometimes important questions. And PROs are a way of collecting some of the most important information from patients and giving them their voice to give us that data. And so I think that PROs, particularly in bradykinin-mediated angioedema, should be used in most patient visits.
Dr. Skarupa, I would like to thank you for your time and for sharing your knowledge with our audience today. And to our audience, thank you for listening, and stay tuned for upcoming episode of Bradykinin Beats, a dialogue with global experts about bradykinin-mediated angioedema.